Question 1. You are working with a client, and their parent offers you a significant monetary tip for doing a good job. According to ethical guidelines, what should you do? A. Accept the tip politely as a sign of appreciation. B. Decline the tip and explain your company policy or ethical code regarding gifts/payments. C. Accept the tip but don't tell your supervisor. D. Use the money to buy supplies for the client. Answer B. Decline the tip and explain your company policy or ethical code regarding gifts/payments. This question is about ethical boundaries, specifically regarding accepting gifts or tips from clients' families. The keyword ethical guidelines tells you there's a rule you need to follow. RBTs have a professional code of conduct that prohibits accepting significant gifts or financial tips from clients or their families because it can create a dual relationship or compromise objectivity. The best practice is to politely refuse and explain that your professional role doesn't allow you to accept personal gifts or money, often citing company policy or ethical standards. Using the money for supplies or not telling your supervisor are not appropriate or ethical responses. Maintaining professional boundaries is crucial for a healthy working relationship and the client's best interest. Question 2. A behavior reduction plan calls for using extinction for a client's attention-seeking whining. This means that when the client whines, A. You should give them a brief scolding. B. You should provide immediate attention. C. You should ignore the whining and withhold attention. D. You should give them a toy to distract them. Answer. C. You should ignore the whining and withhold attention. This question is about implementing an extinction procedure based on the function of the behavior. The plan specifically mentions extinction for attention-seeking whining, and the keyword here is extinction. Extinction involves stopping the reinforcement that is maintaining the behavior. If the behavior happens to get attention, the extinction procedure is to stop giving attention when the behavior occurs, providing a scolding. Negative attention, giving immediate attention, or distracting with a toy would likely reinforce the whining, either with attention or escape/tangible access, not extinguish it. To implement extinction for attention-seeking, you must consistently withhold all forms of attention when the behavior happens. Question 3. When taking frequency data on a client's hitting behavior, you would A. Record how long each hitting incident lasts. B. Count how many times the hitting behavior occurs during the session. C. Mark if hitting occurred at any point during specific intervals. D. Record if hitting is happening at the very end of a specific interval. Answer. B. Count how many times the hitting behavior occurs during the session. This question asks about taking frequency data, which is also called event recording or counting. The concept is straightforward. You count each time the behavior happens. The keyword is frequency, which specifically refers to the number of occurrences. Recording how long it lasts is duration data. Marking if it happens within an interval, partial interval, or at the end, momentary time sampling, are discontinuous measurement methods. Frequency data is used for behaviors with a clear beginning and end that don't happen so constantly that they're impossible to count every single time. You simply keep a tally of each instance you observe. Question 4. During discrete trial training, DTT, the RBT should deliver reinforcement. A. After several correct responses have occurred. B. Immediately after the client provides the correct response to the SD. C. Before giving the instruction, SD. D. Only after the entire session is completed. Answer. B. Immediately after the client provides the correct response to the SD. This question tests your understanding of reinforcement delivery in DTT. In DTT, you present a clear instruction, SD. Wait for the client's response, and then provide a consequence. The key to effective reinforcement is its immediacy. The reinforcement should happen right after the target response to make the connection clear for the client. Waiting too long, option A or D, can accidentally reinforce other behaviors or make it hard for the client to learn which response earned the reward. Delivering reinforcement before the SD, option C, doesn't make sense because the client hasn't had a chance to respond yet. Timely reinforcement is crucial for fast and clear learning. Question 5. If a client throws a toy, behavior, and as a result, you take away a highly preferred item they were playing with, stimulus removed, and throwing toys decreases in the future, this is an example of A. Positive reinforcement, B. Negative reinforcement, C. Positive punishment, D. Negative punishment. Answer: D. Negative punishment. This question describes a scenario involving punishment. The behavior, throwing a toy, decreases in the future, which means it's punishment. The consequence is that a highly preferred item was taken away, stimulus removed, which indicates it's negative. Putting negative, taking away, and punishment, behavior decreases. Together, you get negative punishment. Positive punishment would involve adding something unpleasant. Reinforcement, positive or negative, would result in the behavior increasing, not decreasing. Question 6. You are collecting data on the duration of a client's tantrum behavior. This means you are measuring A. How many tantrums occur, B. How long each tantrum lasts from beginning to end, C. Whether a tantrum occurs during a specific time interval, D. The force or intensity of the tantrum. Answer: B. How long each tantrum lasts from beginning to end. This question is about duration measurement. The term duration refers to how long a behavior occurs. When measuring duration, you start a timer when the behavior begins and stop it when the behavior ends. This gives you the total time the behavior lasted. Counting how many occur is frequency. Checking for occurrence within intervals is discontinuous measurement. Measuring intensity might be part of an operational definition, but isn't what duration specifically measures. Duration is essential for behaviors that occur for varying lengths of time, like tantrums, crying, or sustained engagement in an activity. Question 7. Maintaining client confidentiality means you should A. Discuss client information with your friends and family. B. Share client progress updates on social media without using their name. C. Only discuss client information with your supervisor and treatment team on a need-to-know basis. D. Leave client data sheets visible when you take a break. Answer: C. Only discuss client information with your supervisor and treatment team on a need-to-know basis. This question is about a core ethical responsibility. Client confidentiality. Confidentiality means protecting private client information. The only people you should discuss a client's information with are those directly involved in their treatment, your supervisor, other team members, and only when necessary for providing services. Need-to-know basis. Discussing information with friends/family, posting on social media, or leaving data visible all violate confidentiality rules, like HIPAA in the U.S. Protecting client privacy is paramount and legally required. Question 8. After conducting a preference assessment, you find that bubbles are a high preference item for your client. How should you use this information in therapy? A. Give the client bubbles continuously throughout the session. B. Use bubbles as a potential reinforcer when the client engages in desired behaviors. C. Tell the client they can never have bubbles unless they earn them. D. Only use bubbles as reinforcement for behaviors that are difficult to teach. Answer: B. Use bubbles as a potential reinforcer when the client engages in desired behaviors. This question asks how to apply the results of a preference assessment. The purpose of finding out what a client likes, like bubbles, is to identify potential reinforcers. Things you can offer after a desired behavior to make that behavior more likely to happen again. You wouldn't give high preference items continuously without making them earned. Option A, as this makes them less effective as reinforcers. Telling them they can never have them is counterproductive. option C, and limiting them only to difficult behaviors isn't the best use of a strong reinforcer, option D. The value of knowing preferences is to use them to motivate learning and good behavior. Question 9. When using a physical prompt to help a client perform a skill, you should generally A. Use the strongest physical support possible every time. B. Start with the least intrusive prompt necessary and fade as quickly as possible. C. Keep using physical prompts indefinitely if the client needs them. D. Avoid using physical prompts altogether. Answer. B. Start with the least intrusive prompt necessary and fade as quickly as possible. This question is about using prompts effectively and ethically. The goal of prompting is to help the client succeed, but prompts should only be used as much as needed and for as long as necessary. The principle of using the least intrusive prompt means starting with the gentlest hint that will still help the client respond correctly, and then fading or gradually reducing the help until the client can do it independently. Using the strongest prompt every time isn't necessary or helpful for independence. Keeping prompts indefinitely creates dependence, and avoiding them altogether might prevent learning. The aim is always to fade prompts to promote independence. Question 10. You are using a partial interval recording method to measure a client's off-task behavior. If the behavior occurs at any point during a 1-minute interval, you would A. Record the duration of the behavior. B. Record that the behavior occurred in that interval. C. Record how many times the behavior occurred in that interval. D. Ignore the behavior if it only happened for a short time. Answer. B. Record that the behavior occurred in that interval. This question describes partial interval recording, a type of discontinuous measurement. The key phrase is partial interval and at any point during. With partial interval recording, you divide the observation time into short intervals. You then simply record whether the behavior happened at all during that interval. You don't measure how long it lasted, duration, how many times it happened within the interval, frequency, or ignore it if it's brief. If the behavior happens even for a second within the interval, you mark it as having occurred for that interval. Question 11. If your supervisor gives you feedback on how to improve your implementation of a procedure, your ethical responsibility is to A. Argue with the supervisor if you disagree. B. Immediately implement the feedback and ask clarifying questions if needed. C. Ignore the feedback if you think your way is better. D. Only implement the feedback if the client's parent agrees. Answer. B. Immediately implement the feedback and ask clarifying questions if needed. This question is about your professional relationship with your supervisor and ethical practice. Your supervisor is responsible for overseeing your work and ensuring you are implementing the plan correctly and ethically. When they provide feedback, it's usually based on their expertise and observations of your work and the client's progress. Your responsibility is to take that feedback seriously, implement the changes they suggest to improve your practice, and ask questions if you don't understand. Arguing, ignoring feedback, or needing parent approval for procedural changes from your supervisor are not appropriate professional responses. Think of supervision as coaching designed to make you the best RBT possible for your client. Question 12. A behavior plan instructs you to use positive punishment when a client bites themselves. This means that when the client bites themselves, A. You should provide a preferred toy. B. You should ignore the behavior. C. You should add an immediate consequence that decreases the biting in the future. D. You should remove attention from the client. Answer. C. You should add an immediate consequence that decreases the biting in the future. This question is about implementing a positive punishment procedure. The plan specifies positive punishment, meaning something is added after the behavior, and punishment, meaning the behavior decreases in the future. Therefore, you would add an immediate consequence after the biting behavior that is designed to make the biting less likely to happen again. Providing a toy, reinforcement. Ignoring, extinction for attention, or removing attention, negative punishment, are different procedures. Positive punishment involves adding something like a brief, firm no or response cost if appropriate and outlined in the plan, assuming it decreases the behavior. Question 13. When teaching a new skill using reinforcement, it's important to use a dense schedule of reinforcement initially, meaning A. Reinforce the behavior only occasionally. B. Reinforce every instance of the behavior. C. Only reinforce the behavior if it happens naturally. D. Use only tangible reinforcers. Answer B. Reinforce every instance of the behavior. This question is about reinforcement schedules when teaching new skills. When a client is first learning something new, you want to make sure they understand that the behavior you want is the one that gets the reward. Using a dense schedule, often meaning continuous reinforcement, reinforcing every single correct response, helps the client learn the new skill quickly and makes them motivated to try. Once the skill is learned, you can gradually switch to intermittent schedules, reinforcing sometimes to make the behavior more durable. But for initial teaching, frequent reinforcement is key. Question 14. You are asked to measure the rate of a client's spontaneous greetings example, saying hi to peers. To calculate the rate, you need to know A. How many times the behavior occurred and the duration of the observation. B. How long each greeting lasted. C. Whether a greeting occurred within each interval. D. The intensity of the greeting. Answer A. How many times the behavior occurred and the duration of the observation. This question is about measuring rate. Rate is a measure of frequency. How many times something happens, divided by the time period over which it was measured. So, to calculate the rate, you need two pieces of information: the count of the behavior and the total time you observed. For example, if a client said hi 10 times during a 2-hour session, the rate would be 5 greetings per hour. Duration is how long each greeting lasts. Interval recording and intensity are different measures entirely. Rate gives you a sense of how often a behavior is happening within a given time frame. Question 15. You observe something that looks like a significant bruise on your client. They tell you they fell, but it looks suspicious. What is your primary responsibility? A. Ask the client's parents what happened directly. B. Document the observation and immediately inform your supervisor. C. Ignore it unless the client brings it up again. D. Call the authorities yourself without telling anyone else. Answer B. Document the observation and immediately inform your supervisor. This question is about mandatory reporting and ethical responsibility when suspecting abuse or neglect. Your primary responsibility in this situation is to ensure the client's safety. As a mandatory reporter, you are required to report suspicions. The correct procedure is to document what you observe and immediately report your suspicion to your supervisor. Your supervisor can then guide you on the next steps, which typically involve reporting to the appropriate authorities, like Child Protective Services. According to your state's laws and your company's protocol, asking the parent directly before consulting your supervisor is not the standard procedure and could complicate things. Ignoring it is neglectful. Calling authorities yourself might be a step, but it should generally follow your company's reporting hierarchy and involve your supervisor. Question 16. What role does the RBT typically play in the functional behavior assessment (FBA) process? A. Design and conduct the entire FBA. B. Analyze the FBA data and develop the behavior plan. C. Implement data collection procedures, like ABC data, and inform the supervisor of observations. D. Determine the function of the behavior independently. Answer C. Implement data collection procedures, like ABC data, and inform the supervisor of observations. This question is about the RBT's role in FBAs. An FBA is a process to figure out why a challenging behavior is happening, its function. FBAs are designed and conducted by BCBAs or BCABAs. The RBT's crucial role is to provide the data needed for the FBA, often by collecting ABC data, recording the antecedent, behavior, and consequence, and reporting their observations to the supervisor. You don't design or analyze the assessment, nor do you determine the function yourself. Your data is the foundation for the supervisor's analysis. Question 17. Your client learns to wash their hands at the sink in the therapy room. To promote generalization, which of the following is a good strategy? A. Only allow the client to wash hands in the therapy room. B. Have the client practice washing hands at different sinks, example bathroom, kitchen. C. Tell the client they are now done learning to wash hands. D. Only use the exact same soap and water temperature every time. Answer. B. Have the client practice washing hands at different sinks, example bathroom, kitchen. This question is about promoting generalization. Generalization means the skill learned in one setting or with specific materials happens in other relevant settings, with different people, or with similar materials. To help a client generalize a skill like hand washing, you should plan for them to practice and use the skill in various natural environments where they would actually need to wash their hands, like other sinks. Restricting practice, option A. Stopping teaching too soon, option C. Or always using identical materials, option D, would limit generalization. The goal is for the skill to be useful everywhere it's needed. Question 18. A behavior reduction plan uses differential reinforcement of alternative behavior, DRA, for a client who shouts out in class to get attention. Which of the following is an example of implementing DRA? A. Ignoring the shouting out and also ignoring when they raise their hand. B. Giving the client attention when they shout out, but extra attention when they raise their hand. C. Ignoring the shouting out and giving attention when they raise their hand. D. Punishing the shouting out by having them leave the room. Answer. C. Ignoring the shouting out and giving attention when they raise their hand. This question is about implementing differential reinforcement of alternative behavior, DRA. DRA involves reinforcing a specific alternative behavior while withholding reinforcement for the challenging behavior. In this case, the challenging behavior is shouting out, function, attention, and the alternative behavior is raising their hand. So you would reinforce, give attention for, raising their hand, and use extinction, withhold attention for, shouting out. Option A ignores both behaviors, which isn't DRA. Option B reinforces the challenging behavior, shouting out. Option D is punishment, not DRA. DRA is about teaching and reinforcing a more appropriate way to get the same outcome, attention. Question 19. You are asked to use momentary time sampling to measure a client's on-task behavior. This means you will record if the client is on task. A. At any point during a specific interval. B. From the beginning to the end of the interval. C. At the very end of a specific interval. D. Every time they engage in on-task behavior. Answer. C. At the very end of a specific interval. This question describes momentary time sampling, another type of discontinuous measurement. The key phrases are momentary time sampling and what you record. With this method, you set an interval length, but you only look up and check if the behavior is happening exactly when the interval ends. If the behavior is happening at that precise moment, you record it. If it's not happening at the end of the interval, you don't. Checking at any point during the interval is partial interval recording, and measuring throughout is continuous, duration or frequency depending on the behavior. Momentary time sampling is like taking a snapshot at specific times. Question 20. If a client receives reinforcement after an unpredictable number of correct responses, example, sometimes after 3 responses, sometimes after 7, sometimes after 5. This is an example of which reinforcement schedule? A. Fixed interval, FI. B. Variable interval, VI. C. Fixed ratio, FR. D. Variable ratio, VR. Answer. D. Variable ratio, VR. This question is about reinforcement schedules. The client is reinforced based on the number of responses, ratio, and that number changes unpredictably. Variable. This fits the definition of a variable ratio, VR, schedule. A fixed ratio, FR, would be a set number of responses each time. Interval schedules, phi, VI, are based on time passing, not the number of responses. VR schedules, like those in slot machines or sales commissions, tend to produce high, steady rates of behavior because the client never knows exactly when the next reinforcement is coming, so they keep responding. Question 21. Which of the following is an example of crossing a professional boundary with a client's family? A. Providing parent training on implementing a behavior plan. B. Inviting the family to your personal birthday party. C. Communicating with the family about the client's progress. D. Explaining why you are collecting specific data. Answer. B. Inviting the family to your personal birthday party. This question is about maintaining professional boundaries. Inviting a client's family to a personal social event is an example of creating a dual relationship, being both their therapist/technician and a personal friend. This blurs the lines of the professional relationship and is generally considered unethical because it can compromise your objectivity or lead to conflicts of interest. Providing training, communicating about progress, and explaining procedures are all appropriate professional interactions. Your relationship with the family should remain focused on the client's treatment goals. Question 22. When teaching a client to ask for items or activities they want, you are teaching them to use A. Tax. B. Mans. C. Intraverables. D. Imitation. Answer. B. Mans. This question refers to B. F. Skinner's types of verbal behavior. A mand is a request. It's asking for something you want or need, like saying cookie when you want a cookie. Mans are controlled by motivation. They are reinforced by getting the item/action requested. Tax are labels, saying cookie when you see a cookie. Intraverables are conversational responses, saying cookie when someone asks, "What's your favorite snack?" Imitation is copying someone else's behavior. Teaching a client to ask for things is specifically teaching them to mand. Question 23. You are teaching a client to put on a shirt using backward chaining. This means you will A. Start by teaching the first step, picking up the shirt, and prompt through the rest. B. Start by teaching the last step, pulling the shirt down, and prompt through the steps before it. C. Prompt the client through all steps of putting on the shirt and reinforce at the end. D. Teach each step in random order. Answer. B. Start by teaching the last step, pulling the shirt down, and prompt through the steps before it. This question is about backward chaining, a method for teaching multi-step skills. In backward chaining, you guide the client through all the steps of the task except for the very last step. You teach the client to complete the last step independently first. Once they master the last step, you then teach them the second to last step plus the last step, and so on, working backward through the chain until they can do the whole task from the beginning. Forward chaining starts from the first step. Total task chaining prompts through all steps and reinforces at the end. Backward chaining is often used because the completion of the task, getting the shirt on, serves as the natural reinforcer after completing the last step independently. Question 24. For a behavior that happens very quickly multiple times within a minute, like hand flapping, which measurement method would likely be the most practical and accurate for an RBT during a typical session? A. Duration. B. Frequency/count. C. Partial interval recording. D. Momentary time sampling. Answer. C. Partial interval recording. This question asks about choosing the most practical measurement for a specific type of behavior. Hand flapping often happens very rapidly and can be difficult to count every single instance accurately throughout a session. Frequency. Duration isn't the most informative for this type of behavior unless you are interested in how long each episode lasts. Momentary time sampling might underestimate the behavior, since it only captures it at specific moments. Partial interval recording is often a practical choice for high-rate, continuous, or behaviors without a clear start/end, because you just need to note if it happened at all during an interval, which is easier than counting or timing every single flap. It gives an estimate of occurrence. Question 25. If a client responds to the instruction, touch red, by touching the red object, because touching red has been reinforced in the past when you said touch red, but does not touch red when you say touch blue, this is an example of the red object functioning as in A. S delta S, B. Conditioned punisher, C. Discriminative stimulus, SD, D. Unconditioned reinforcer. Answer C. Discriminative stimulus, SD. This question describes a discriminative stimulus, SD. The instruction touch red is the stimulus. The client has learned that when this specific stimulus is present, touch red, responding by touching the red object will lead to reinforcement. They also show they don't respond that way when a different stimulus is present, touch blue. This means they have discriminated, and touch red has become an SD for touching the red object. It signals that reinforcement is available for that specific response. And S delta signals that reinforcement is not available. Conditioned punishers decrease behavior. Unconditioned reinforcers are naturally reinforcing without learning. Question 26. According to ethical guidelines, which of the following is generally acceptable regarding gifts? A. Accepting a large gift card from a client's family during the holidays. B. Accepting a small, homemade thank you card from a client. C. Regularly receiving expensive items from the client. D. Soliciting gifts or tips from the client's family. Answer B. Accepting a small, homemade thank you card from a client. This question revisits the topic of gifts but asks what is acceptable. While RBTs should not accept significant gifts or monetary tips, accepting small, symbolic gestures of appreciation, like a homemade card or drawing from a client, is often considered acceptable as it's not typically seen as creating a dual relationship or compromising objectivity due to its minimal value and personal nature from the client. Accepting large gift cards, expensive items regularly, or asking for gifts are all clear ethical violations involving boundaries and potential exploitation. The key is the value and intent. Small, personal gestures are usually okay. Significant or monetary gifts are not. Question 27. You are teaching a client to request a toy while playing with them. You wait for them to reach for the toy, then prompt them to say toy, and immediately give them the toy. This approach is most characteristic of A. Discrete trial training, DTT. B. Naturalistic environment training, N8. C. Mass trials. D. Shaping. Answer B. Naturalistic environment training, N8. This question describes a teaching approach. The key phrases are while playing with them and using a natural opportunity, reaching for the toy, to prompt the request and provide the item immediately. This fits the description of naturalistic environment training, N8, where teaching happens within the client's natural environment and activities, using their motivation. Discrete trial training, DTT, is typically more structured, often done at a table with planned trials. Mass trials involve repeating the same instruction many times. Shaping is changing the form of a behavior, not the context of teaching a request. NET integrates teaching into everyday interactions. Question 28. As an RBT, what should you do with the data you collect during a session? A. Keep the data to yourself for your own records. B. Analyze the data and make decisions about changing the intervention plan. C. Give the data to the client's parents to review and make decisions. D. Provide the data to your supervisor for review and analysis. Answer D. Provide the data to your supervisor for review and analysis. This question clarifies the RBT's role regarding data analysis and decision-making. As an RBT, your job is to accurately collect the data, but you do not typically analyze it or make independent decisions about changing the client's behavior intervention plan. That is the supervisor's responsibility. The data you collect is essential information that your supervisor uses to monitor progress, make graphs, and decide if the plan needs adjustments. Sharing it directly with parents for them to make treatment decisions is not appropriate, and keeping it to yourself makes it useless for the treatment team. Your data is a vital communication tool for your supervisor. Question 29. You are teaching a client to discriminate between a picture of a cat and a picture of a dog. To minimize errors during the initial teaching phase, you might use errorless teaching. An example would be A. Waiting for the client to make a mistake and then correcting them. B. Providing an immediate prompt to help the client respond correctly when presenting the SD. C. Only presenting the picture of the cat until they master it, then adding the dog. D. Making the pictures look very similar to challenge the client. Answer: B. Providing an immediate prompt to help the client respond correctly when presenting the SD. This question is about errorless teaching during discrimination training. Errorless teaching is a strategy used, especially when teaching discriminations, to prevent the client from making mistakes. This is done by providing a prompt immediately after the instruction, SD, to ensure the client responds correctly, making it errorless. Reinforcement is then delivered for the prompted correct response. This helps the client learn the correct association quickly without practicing errors. Waiting for a mistake, teaching one at a time, though sometimes a phase before errorless, or making stimuli too similar are not part of the core errorless teaching method, which relies on proactive prompting. Question 30. If a client engages in hitting themselves, behavior, and there is no apparent external trigger or social consequence, but it seems to calm them down or provides some internal sensation, the function is likely. A. Attention. B. Tangible. C. Escape/avoidance. D. Automatic, self-stimulatory. Answer: D. Automatic, self-stimulatory. This question asks about the function of behavior based on the scenario. The description highlights that the behavior isn't happening for attention from others, to get an item, or to escape/avoid something in the environment. Instead, it seems to be maintained by an internal sensation or regulation for the individual, calm them down, or internal sensation. This is characteristic of an automatic or self-stimulatory function, where the reinforcement for the behavior comes directly from the behavior itself or its immediate physiological effects, without involving another person or a change in the external environment. Question 31. Why is it important to fade prompts when teaching a new skill? A. To make sure the client becomes dependent on your help. B. To ensure the client is responding to the prompt instead of the instruction. C. To promote the client's independence and ensure they respond to the natural cue/SD. D. To make the task more difficult for the client. Answer: C. To promote the client's independence and ensure they respond to the natural cue/SD. This question asks about the purpose of prompt fading. The goal of using prompts is temporary support. Prompt fading is crucial because you want the client to learn the skill and perform it when they encounter the natural instruction or cue in their environment, not because you are always there to prompt them. Fading prompts helps the client become independent and ensures that the instruction, SD, is what triggers the behavior, not your assistance. You don't want them to become prompt dependent. Fading makes the skill functional and independent. Question 32. You are teaching a client to say the word water. Initially, you reinforce any sound that starts with wa. Then you only reinforce sounds that are closer, like wa. Finally, you only reinforce saying water. This is an example of A. Chaining. B. Discrimination training. C. Shaping. D. Generalization. Answer: C. Shaping. This question describes the process of shaping. Shaping is used to teach a new behavior by reinforcing behaviors that are gradually closer and closer to the desired target behavior. Successive approximations. You start by reinforcing a simple behavior the client can already do, then reinforce slightly more complex behaviors that are closer to the goal, while stopping reinforcement for the earlier, simpler versions. You are literally shaping the behavior step by step. In this example, you shape saying water by reinforcing approximations, wu sound wall, until the client says the full word. Chaining is for multi-step tasks. Discrimination is responding differently to different stimuli, and generalization is doing the same behavior in different contexts. Question 33. Your supervisor provides feedback that you need to improve your data collection accuracy. What is the professional way to respond? A. Get defensive and explain why the data discrepancies aren't your fault. B. Thank your supervisor for the feedback and ask for clarification or further training on data collection. C. Ignore the feedback and continue collecting data the same way. D. Tell the supervisor that data collection is too hard and you don't want to do it. Answer: B. Thank your supervisor for the feedback and ask for clarification or further training on data collection. This question is about professional behavior and accepting feedback. Receiving feedback, even critical feedback, is a normal part of supervision and professional growth. The appropriate and ethical response is to be receptive, thank your supervisor for their guidance, and actively seek to understand and improve. Asking clarifying questions or requesting more training shows that you are committed to learning and providing quality services. Getting defensive, ignoring feedback, or refusing tasks are not professional responses and could jeopardize your position and the client's progress. Question 34. If a client is engaging in a severe challenging behavior that poses immediate danger to themselves or others, and you have been trained on crisis intervention procedures as part of the behavior plan, your first step, after ensuring safety as much as possible, is usually to A. Try to implement the planned extinction procedure. B. Immediately call the client's parents. C. Implement the documented crisis plan procedures and signal for help if needed. D. Leave the area to ensure your own safety. Answer: C. Implement the documented crisis plan procedures and signal for help if needed. This question is about responding to a crisis situation. When a client's behavior is dangerous, your priority is safety. If there is a documented crisis plan for this specific behavior and you have been trained on it, your role is to implement those procedures immediately. These plans are designed to safely manage the behavior until the situation de-escalates or help arrives. Trying less intensive procedures like extinction, option A, or leaving the area, option D, are not appropriate for immediate danger, while parents may need to be informed later, option B. Implementing the crisis plan is the immediate clinical response required in the moment of danger. Always follow the specific crisis plan and your training. Question 35. You want to conduct a paired stimulus preference assessment with a client who can make choices by pointing. You have 6 items you want to test. In a paired stimulus assessment, you would present A. All 6 items at once and ask the client to pick one. B. 1 item at a time and see if the client interacts with it. C. 2 items at a time and ask the client to choose one. D. 1 item and 1 non-preferred item at a time. Answer: C. 2 items at a time and ask the client to choose one. This question is about a specific type of preference assessment called paired stimulus, also known as forced choice. The key phrase is paired stimulus. In this method, items are presented in pairs, and the client is asked to choose one from the pair. Each item is paired with every other item multiple times. This helps establish a hierarchy of preference. Presenting all items at once is multiple stimulus. Presenting one at a time is single stimulus. Presenting one preferred and one non-preferred isn't the standard paired stimulus method. Paired stimulus is about presenting two items and seeing which one is chosen when forced to pick between them.